Okay, let's start.
Sir.
You guys can see screen?
Yes, sir.
Yes, sir.
Okay,
Yes,
let's
sir.
start. Okay. Okay, we were discussing about all the fibers, pre-ganglionic fibers are cholinergic. Okay, they're using what? Cholinergic fiber, they're using acetylcholine. Okay. Okay, now move on. Post-ganglionic fiber. You can see here. This is the post-ganglionic fiber of sympathetic system. It's lengthy, eh? So here we use what? In the post-ganglionic fiber of sympathetic system using norepinephrine. Norepinephrine, okay? Adrenaline, noradrenaline, same thing, okay? Norepinephrine. Norepinephrine. Done? In post-ganglionic fiber parasympathetic system, here you again using acetylcholine. Clear? Understand or not? Here
Yes,
using
sir.
what? Norepinephrine. Post-ganglionic fiber. Which fiber? Post-ganglionic neuron or fiber. Okay. The post-ganglionic neuron using acetylcholine. Which system? Parasympathetic system. Okay. The post-ganglionic fiber using norepinephrine. Norepinephrine. Which system? Sympathetic system. So here the only difference here, okay? The post fiber difference. Understand? In parasympathetic system, pre-ganglionic and post-ganglionic, they're using what? Acetyl. Understand? Pre and post, they both using acetylcholine. So the parasympathetic system, both neuron known as cholinergic neuron. Understand? Cholinergic neuron. So this system is cholinergic system. This system is cholinergic system. Done? But in sympathetic system, the pre using acetylcholine. Okay. How about the post? Post using norepinephrine. Okay. So the main function depend upon post, because the post fiber, here you can see the picture here again. The post fiber connected to cell. Yeah. Main function here. The post fiber using acetylcholine, then parasympathetic. If the post fiber using norepinephrine, then it's a sympathetic system. Clear? It's a sympathetic system. So this fiber, post fiber using norepinephrine, this fiber known as adrenergic fiber. Which fiber? Adrenergic fiber. Adrenergic is an adrenergic neuron, and this system known as adrenergic system. Understand?
Yes, sir.
What is cholinergic system? What is adrenergic system? Now we focus on these 2 points. Cholinergic system. Cholinergic system. This cholinergic system using acetylcholine. Okay. Second system, adrenergic system. Adrenergic system. Adrenergic system using specially norepinephrine. Okay. Also can use epinephrine. Okay. Epinephrine. Both can be used. Epinephrine. Understand? So this your sympathetic system. How about this? Parasympathetic. Everyone till here, all these points done?
Done, sir.
Yes, sir.
Yes, sir.
Cholinergic. What is meaning of cholinergic? If you not know these names, then how you can understand the drug? It's very hard. Okay. So first you must know what is cholinergic system, what is adrenergic system. Okay, now we first start the pharmacology of in autonomic nervous system pharmacology. We have four drug groups. Okay, pharmacology of autonomic system. If you increase, for example, one system is cholinergic system. One system is cholinergic system. If you increase the action of cholinergic system, okay, it means agonist. It means what mean agonist? You helping cholinergic system, okay. If you going against cholinergic system, it's known as antagonist. It's known as antagonist. Now we have two groups of drugs here: cholinergic system agonist, cholinergic system antagonist. Two types of drugs. Okay, the drug helping drug increase the cholinergic system. Increase the cholinergic system. What the meaning of this? What is the acetylcholine here? Okay, if you increase the function of acetylcholine, you supporting. Now you helping acetylcholine. If you decrease the function, now you blocking acetylcholine. Yeah, understand? So the drugs here acting on cholinergic system, if they increase the activity of acetylcholine, it's known as cholinergic agonist. Cholinergic, cholinergic agonist. Okay. Second group, cholinergic, cholinergic antagonist. Cholinergic antagonist. Cholinergic agonist. Cholinergic agonist working on parasympathetic system, they increase parasympathetic function of parasympathetic system. Cholinergic antagonist, they decrease parasympathetic function. Understand? Clear or not?
Clear.
Okay. You know mimicry.
Yeah.
Mimic means something similar. Yeah.
Because
Mimetic. If you add like word here, mimetic. Mimetic mean to do something like, yeah, similar to make a copy. Mimicry. Parasympathomimetic. Parasympatho, parasympathomimetic. Parasympathomimetic drugs. So what the meaning of this parasympathomimetic drug? The same thing. Cholinergic agonist. Okay, they're different name. Cholinergic agonist, they increasing sympathetic system, increase the function of sympathetic system. Have another name, parasympathomimetic drug. Understand? Parasympathomimetic or cholinergic agonist, the same thing. Okay, how about another name for cholinergic antagonist? Lytic. What mean lysis? Lytic mean to break something, to go against something. Lytic. Parasympatholytic. Parasympatholytic. Okay. Parasympatholytic means cholinergic antagonist. Cholinergic antagonist. Parasympathomimetic means cholinergic agonist. These four names the same thing, okay? Cholinergic agonist, parasympathomimetic. Sometimes they write parasympathomimetic. Sometimes they write the name cholinergic agonist. Both are the same name. Cholinergic antagonist, parasympatholytic. Understand? Cholinergic agonist, cholinergic antagonist. Okay. How about the drugs of sympathetic system? In sympathetic system, what the name of sympathetic system? Adrenergic system. Adrenergic agonist. We have four groups of drugs. Adrenergic agonist, adrenergic, adrenergic antagonist, adrenergic agonist, adrenergic antagonist. Adrenergic agonist, it's a, they increase the sympathetic system. Sympathetic system increasing, okay? They help sympathetic system. They block sympathetic system. Sympathetic system activity decrease. It's adrenergic antagonist. These four groups done: cholinergic agonist, cholinergic antagonist, adrenergic, agonist, adrenergic, antagonist. Clear or not? Everyone clear?
Yes, sir.
Clear, sir.
Yes, sir.
Okay, what's another name for this system? Sympatheto-mimetic, sympatheto-mimetic. Not confused with the name, okay? Very easy. Sympatholytic, okay? Same name. Sympathetol. Mimetic mean same, helping, agonist. Lytic mean against something, you doing break something, antagonist. These four types of drug we discuss in autonomic nervous system. Okay, cholinergic, agonist, cholinergic, antagonist, adrenergic, agonist, adrenergic, antagonist. Okay, now to understand this pharmacology, now we move on receptor. Okay, I move on receptor. How these drug acting. Okay, pre-ganglionic. What is this? Ganglia. How about this? Post-ganglionic. Which system? Or tell me which system? Is it sympathetic or parasympathetic? Pre is short. You can see. Pre is short in length. Post is very lengthy. Which system?
Sympathetic.
Yes,
Sympathetic.
a sympathetic system. How about this fiber? Very long pre. Ganglia. Then post. It's a parasympathetic. Understand?
Parasympathetic.
Okay.
Yes, sir.
Here we're using what? Acetylcholine.
Acetylcholine.
Here you're using what? Norepinephrine. Okay. Here you're using what? Parasympathetic. Acetylcholine. Here
Acetylcholine.
acetylcholine. Understand? It's a pre, it's a post. Now what the receptor here? The receptor for acetylcholine. The receptor for acetylcholine. Acetylcholine. First we summarize the receptor. Acetylcholine having number one receptor, nicotinic receptor. Which receptor? Nicotinic receptor. And acetylcholine having another receptor, muscarinic receptor. Nicotinic receptor and muscarinic receptor. Okay. Nicotinic receptor having two types. Number one, NN. Number two, NM. Okay. NN. Muscarinic receptor five types. M1, M2, M3, M4, five types. Okay. Acetylcholine. What is this receptor? Receptor between nerve and nerve. N stands for nerve. Nerve and nerve. The receptor between pre and post ganglionic. Acetylcholine. Using what? Which receptor? N. Clear or not? Okay. Done. It's a cell here. Okay. It's a cell. Here we are having cell. This system, sympathetic system. This system. Okay. This system, parasympathetic system. The non-epinephrine here, acetylcholine. Which receptor on the cell? Here receptor. Here receptor maybe M1, maybe M5, maybe M2, maybe M3. It depends upon what type of cells. Okay. It depends upon what type of cells we are using here. Okay. Understand? Here we have a muscarinic receptor, M receptor here, and N receptor here, and N receptor here. Only one thing left. Okay. Which receptor we use for norepinephrine? Receptor we use for norepinephrine. Receptor used for norepinephrine alpha. Receptor used for norepinephrine beta. Receptor used for norepinephrine alpha 1, alpha 2, beta 1, beta 2, beta 3. See receptor there. Okay. So alpha and beta receptor for norepinephrine. Understand? Alpha and beta receptor for norepinephrine. Acetylcholine having receptor nicotinic receptor and muscarinic. Muscarinic, this is M word, okay? M receptor. N word for nicotinic receptor. Understand? Okay, the receptor here, N means this receptor present between nerve and nerve. What is this? It's a nerve. Preganglionic nerve, postganglionic nerve, preganglionic nerve, postganglionic nerve. Between these two nerves, we having receptor NN. What stands for NN? Nerve to nerve. Understand? Nerve to nerve. What mean the NM? M stands for muscle. This receptor present between nerve and muscle. Okay? Nerve and muscle. NM receptor. Understand? NM receptor only present for muscle. Which muscle? Skeletal muscle. Which muscle? Skeletal muscle only. Okay. They having receptor NM receptor. Which receptor? NM receptor. See, the receptor naming of receptor done. Acetylcholine having two receptors, N receptor, nicotinic receptor, and muscarinic receptor. Muscarinic receptor having 5 types, M1, M2, M3, M4, and M5. And nicotinic receptor, they having 2 types, N and M. Clear? Over the norepinephrine, they having receptor alpha and beta. Alpha 1, alpha 2, beta 1, beta 2, beta, and beta 3. Okay. So these are the receptors used by parasympathetic system and sympathetic system. Okay, first we start about the pharmacology of parasympathetic system. Still here clear? I am moving step by step. First, the anatomy is done. Yeah. The pre-sympathetic fiber, post-sympathetic fiber, cholinergic system, adrenergic system. I explain one by one thing, step by step. Okay, now we move on real pharmacology. Okay, now focus on. First, we learn about the sympathetic, parasympathetic system pharmacology. Parasympathetic system pharmacology. Our first topic. Okay, parasympathetic system pharmacology. Parasympathetic system pharmacology. Which system? This drug system is known as cholinergic system. Yeah, cholinergic agonist and cholinergic, two groups here. Cholinergic antagonist, agonist and antagonist. Okay, clear? So we're using a receptor here. The using receptor. Which receptor we use in parasympathetic? Parasympathetic system using acetylcholine. Understand? So this acetylcholine having 2 receptors, nicotinic receptor and muscarinic receptor. Understand? This muscarinic receptor, how many types? 1, 2, 3, 4, and 5. And these types, nicotinic N and nicotinic M. Okay? Understand? Nicotinic N and nicotinic M. Okay. Now we talk about better distribution of receptor. Then you very easily can understand what the receptor function here. Distribution of receptor, where the receptor is present. Okay. For M1 present where? M1 present on parietal cell. This you need to memorize. Parietal cell. Do you know stomach parietal cell? Parietal cell. Parietal cell, they're doing what? They're producing HCl. Okay. Parietal cell producing HCl. M2 receptor. M2 receptor present where? On node. Node of heart, SA node, AV node. AV and SA. Nodes of the heart. Okay. M2 present on heart. Where? On node. Understand? So on node doing what? Heart rate decrease. It's a parasympathetic. Later we'll talk about the function of parasympathetic. M3. Now move on M3. M3 present on number 1. Exocrine gland. Where? Exocrine gland, sweat gland. Yeah. Right. Another gland. Salivary gland. Okay. Salivary gland. These 2 glands very important. Another gland, lacrimal in your eye for lacrimation for tears. Lacrimal gland in eyes. Okay. So sweating, increase salivation, saliva. increase watery eye, increase water inside the eye. It's a M3. Understand? It's a M3 receptor present on exocrine gland. M3 receptor also present on smooth muscle. Where? M3 receptor present on smooth muscle. Smooth muscle present in GIT. Okay. Smooth muscle present in respiratory. Understand? Smooth muscle present in GIT. Smooth muscle present in respiratory. Smooth muscle present. Do you know smooth muscle present with hollow organs, tube like this is done in histology, in vessels. Yeah. In the GLT, GLT, smooth muscle doing what? Peristalsis. Yeah. Smooth muscle doing what? Peristalsis. In the respiratory, smooth muscle, if a smooth muscle relax, then what happens? It can lead to bronchoconstriction or bronchodilation. Your bronchi can dilated, can constitute. Okay. In the vessel, vasodilation. So smooth muscle, hollow organ. Smooth muscle present in urinary bladder. Urinary bladder. So bladder, when bladder contract, if urinary bladder contract, micturition. You can do the micturition. So it's a bladder contract. So smooth muscle. M3 present on smooth muscles. GIT function affected. That's why I've been putting stress on this autonomic nervous system pharmacology, because you can see many system controlled by autonomic nervous system. So if you have disease of GIT, if you have disease of respiratory, you can use drugs from belongs to autonomic nervous system. You can easily use to treat the disease. Okay. So respiratory system, vessel system, urinary system, they having smooth muscle. M3 receptor. But the location for M4 and M5. M4 and M5. These two receptors present in brain. Present in brain. In your memory area. In memory part. Okay. M4 and M5 present in brain. Understand? So M4 and M5 present in brain. M1, 2, 3. This is very important. Okay. So if you use drug to stimulate parasympathetic system, your HCl increase or decrease, heart rate increase or decrease, secretion increase or decrease, peristalsis increase or decrease. Understand? So this is a location of M1, M2, M3, M4, and M5. This location done. Muscarinic receptor location. How about this location? Where is NN? Tell me. NN I already explained. Nerve to nerve. Yeah? It's present in nerve and nerve. It's not much important for us. Okay? Another receptor. M stands for muscle. M stands for muscle. Okay? Which muscle? Skeletal muscle. Not smooth. Okay? Not heart muscle. Skeletal muscle. So contraction. The contraction of skeletal muscle depend upon acetylcholine. Okay, and M receptor. The receptor pharmacology done. This receptor we use in sympathetic system and parasympathetic system. Okay, receptor used in sympathetic and parasympathetic system. First we focus on parasympathetic system only. Okay, parasympathetic system using acetylcholine. Acetylcholine use N receptor and M receptor. N receptor present between nerve and skeletal muscle. Only these two locations. M receptor one. These 4 and 5 present in brain are explained. Okay, 4 and 5 in brain. M1 on stomach. M2 on heart. M3 on smooth muscle and exocrine gland. Understand? M1, M2 heart, control the heart rate. M3 present on exocrine gland and smooth muscle. Exocrine gland and smooth muscle. Clear? The receptor distribution you guys understand? Okay. M1, M2. If you guys move step by step, then you usually can understand what the mechanism of drug, how this drug used for that disease, this disease like this. Okay. Okay, now we move on. What are the function of parasympathetic system? What are the functions of parasympathetic system? Okay. To understand the effect of drug, so first you must know what normal thing, normal physiology, what the parasympathetic system is doing in your body. Okay, I move receptor wise. Okay, M1 doing what? Gastric secretion. Simple. Gastric secretion. Okay, gastric secretion. M2 doing what? Control heart rate. They decrease the heart rate. Okay. M3 doing what? M3 lot of function. Okay. M3 peristalsis. Yeah. M3 doing what? Peristalsis. M3 doing what? Micturition. Yes. M3 doing what? Salivation. Saliva. M3 doing what? Sweating. M3 doing what? Lacrimation. These are the functions. The parasympathetic system. What happened with the respiration? What happened with the CVS system? What happened with the eye? All system affected. Okay. In CVS system, if parasympathetic system is moving, like is activated, blood pressure going down. Okay. Heart rate going down. Clear? Your blood pressure going down. If you stimulate parasympathetic, your blood pressure, patient blood pressure going down, BP low, heart rate going down. Understand? If parasympathetic system is stimulated. And if parasympathetic stimulated, then what happens? What happens with GIT system? Too much secretion of GIT increase. Yeah. What happens? Motility of GIT. Motility mean peristalsis. Motility of GIT increase. What happened with the skin? Sweating increase. What happened with the like eyes? Lacrimation. Number 5. Lacrimation increase. Okay. Lacrimation mean watering eye, watering from eye, like tearing. Okay. Lacrimation increase. What happened with another gland like sweat gland? Saliva, salivation increase. Saliva, salivation increase. Okay. Understand or not these functions?
Yes, sir.
So these are normal functions, yeah, done by parasympathetic system. So now we use some drugs here. So what are the drugs we use in first system was cholinergic. First group, cholinergic agonists. So these cholinergic agonists, they're doing what? They increase the activity of parasympathetic. Understand? So they increase the activity of parasympathetic. So if you use these drug in any patient, increase activity of parasympathetic, what happens with the patient? Decrease blood pressure, decrease heart rate, increase lacrimation, increase salivation, increase sweating, increase GIT motility, increase GIT secretion, and also number 7 was micturition, bladder contraction, urinary bladder. Number 7 you also can add micturition. Okay. Okay. Now listen here. We apply on patient. If someone come to you having problem like constipation, okay, having issue with the GIT motility after surgery, the GIT is not working, having constipation, you can use these drugs. If someone come to you with dry eyes, no tear in the eyes, yeah, you can use these drugs to increase the tear. If someone have problem with no sweating here, you can use these drugs. Understand? If someone have problem, then no bladder contraction, no micturition, no urine there, you can apply these drugs. So it's here we need to understand. So what is the normal function here? How these drugs will work? Okay. What the name of this drug? I first write the name here. The name number one, pilocarpine. Pilocarpine. This is parasympathetic cholinergic agonist. Okay, pilocarpine. Pilocarpine is a parasympathetic agonist drug. Another drug here, the stigmine family. Stigmine. Stigmine family. In stigmine family, we having neostigmine, rivastigmine, pyridostigmine, physostigmine, stigmine, same family. Okay. So all these drugs, they increase the activity of parasympathetic system. Understand? So these are some names here. Okay. Pilocarpine, neostigmine. Another name, bethanechol, is a commonly used drug. Bethanechol, carbachol. No need to worry about this name. You must memorize. This drug belongs to which system? If you know this, it's okay for you at MBBS level. Okay. Bethanechol, carbachol. Bethanechol, carbachol. Another drug name, ecothiopate. 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 So these are some cholinergic agonists. Understand? Pilocarpine, bethanechol, carbachol, ecothiopate, and stigmine family. The stigmine family. Rivastigmine, pyridostigmine, physostigmine. Okay. Another drug group, tacrine. Another drug group, tacrine, galantamine, tacrine, galantamine. Another, donepezil, donepezil, donepezil. Tacrine, galantamine, donepezil. These drugs very special for M4 and M5. Now you guys tell me these drugs going where in brain? Yeah, these drugs going where in brain. So in brain they're doing what? M4 and M5 they present in memory part. Yeah, is someone having memory loss? These drugs will help to increase memory. The very famous disease of memory, Alzheimer disease. Yeah, Alzheimer disease. These drugs very useful in Alzheimer disease. What is that treatment of choice? The drug of choice for Alzheimer disease. So in Alzheimer disease, what happen inside the brain? Decrease acetylcholine. So these drugs doing what? These drugs increase acid. What are we learning here? We're learning the drugs that increase activity of parasympathetic system. It's mean they increase the level of, understand?
Yes, sir.
Increase. So if you increase parasympathetic system, mean you increase acetylcholine. You increase acetylcholine in brain. If some person having memory issue, you give the drug, increase acetylcholine in the brain. These drugs can improve memory. Understand? So now,
Yes,
how
sir.
these drugs are working? How these drugs are working? To understand that, we must know how the acetylcholine is produced. It's a one nerve, okay? Presynaptic nerve. Here is the cell here. Okay? So what receptor here? It depends upon you using which thing, okay? Using this cell belongs to stomach, this cell belongs to heart, this cell belongs to smooth muscle. It depends upon receptor, okay? M1 or M2 or M3 or M4 or M5. Understand? Okay. So this acetylcholine we produce here. Acetyl CoA, acetyl CoA, combined with choline, combined with choline. What's the product here? Acetyl choline. So how you produce this? So using here enzyme. What enzyme? Acetylcholine transferase. Acetylcholine transferase. Okay. Now this acetylcholine here. Now this acetylcholine stored here. Okay. When current is come, now current come. Now acetylcholine come out. This acetylcholine is here now. Acetylcholine attached with receptor. Acetylcholine attached with receptor. This receptor may be an M. This receptor may be 1, 2, 3, 4, 5. It depends upon organ. Okay. It depends. It may be stomach, maybe heart, maybe smooth muscle, maybe exocrine gland. It depends upon which receptor you're using here. Okay. So acetylcholine now in what is this space? This synaptic space. Yeah, it's a synaptic. It's a synapse. Synaptic space. So this acetylcholine after action, acetylcholine breakdown done by acetylcholine esterase. Acetylcholine. Which enzyme? Acetylcholine esterase. This enzyme doing what? This enzyme break acetylcholine. Okay. After action, the 70% acetylcholine going back and 30% acetylcholine break. This acetylcholine break into choline and acetate. Choline and acetate. This choline go back to nerve and this acetate is a waste product. It must go out in urine. So it's a breakdown here. Okay. So if you block this enzyme, now you guys tell me what happened with acetylcholine here. You release 100%. Okay. You release 100%. 30% breakdown and 70% automatically go back by itself. Okay. So if you block this enzyme doing what? Break acetylcholine. If you block this enzyme, so can you break acetylcholine? Of course not. Yeah. If you block this enzyme. If you block this enzyme, what happen here? Increase acetylcholine in synaptic space. This is the drug is how it's acting on the system. Okay. So the drug doing what? What the name of the drug? Acetylcholine esterase inhibitor. Understand? How the drug increase acetylcholine? The drug block esterase enzyme. Understand? The drug block esterase enzyme. So when the drug block esterase enzyme, no more breakdown. The acetylcholine will increase. Okay. This is acetylcholine increase. Acetylcholine, the drug's family, acetylcholine esterase inhibitor. Acetylcholine esterase inhibitor. Okay. This acetylcholine esterase, all this is stigmine family. Let me explain. Okay. This is a full stigmine family. Eicosaphat. So this all these are this donepezil, glantamil, all these drugs are acetylcholine esterase inhibitor. Let me explain. Okay, the group according to group. So first you need to understand how these drugs increase acetylcholine. These drugs, how they increase and how they helping acetylcholine, they block the breaking enzyme. So these drug group known as acetylcholine esterase inhibitor. Understand? Acetylcholine esterase inhibitor. If you block this enzyme, then no more breakdown. If no more breakdown, acetylcholine will increase. Understand? So now acetylcholine acting for a long time and increase the function of parasympathetic system. Clear?
Yes, sir.
Here is okay. Tomorrow class I will explain one by one all drugs of parasympathetic system. Okay. You try to revise it. First, you try to memorize the receptor location. Then very easy to understand these drugs. Okay.
Yes, sir.
Okay, sir.
Yeah. If you have any question, you can send me group. Now I have to prepare
Okay, sir.
myself.